Up next, I am going to palpate for thoracic expansion. So I'm just going to place my thumbs here and have you take a deep breath. Very good. I see that my thumbs move symmetrically. Thoracic expansion is symmetric. Next, I'm going to feel for tactile firmitus. So I'll just have you say the word or the number 99 for me as I move my hands down your back.
99, 99, 99, 99, 99, 99.
Very good. Tactile firmitus is present and symmetric in the posterior chest wall. Next, I'm going to percuss over your lung fields. So I'm going to have you kind of lean forward and cross your arms in front and bring your chin down to your chest. Very good. And I'm going to move over here to your lateral fields. And the last spot. Very good. Resonance to percussion in all lung fields and symmetric. Next, I am going to listen for consolidation. So I am going to have you just say the letter E as I move my stethoscope down your back.
E, 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 E,
And the last spot.
E, E.
Very good. Breath sounds. I do not hear any consolidation with the letter E. Next, I'm going to listen for her breath sounds. So I'm just going to have you take deep breaths in and out when I move my stethoscope, okay? Okay, deep breath. Last spot. Deep breath. Deep breath. Very good. Breath sounds normal and symmetric. I do not hear any adventitious breath sounds in all fields. Next, I'm going to assess her posterior chest wall for CVA tenderness. Do you have any pain or tenderness when I feel here? No. So now you're going to feel me tap a couple of times. Any pain or tenderness? Pain or tenderness? Nope. Very well. So that is normal. I will have you turn around now. We are going to proceed with your anterior chest wall assessment. I'm going to unsnap your gown here. Okay, take a couple of deep breaths for me. Okay, I notice that her chest wall rises symmetrically. I do not see any accessory muscle use or retractions. Her skin is not pale. I do not notice any cyanosis or diaphoresis. I'm going to palpate her skin now for any lumps or any tenderness. Do you have any tenderness when I touch here? No. Any tenderness? No. And I'm going to feel down here by your diaphragm. Any tenderness there? No. No tenderness? Tenderness? Okay, very well. That is normal. I am going to now look at your skin turgor here. Okay, less than 3 seconds. That is normal. And then finally, we are going to do your anterior lung sounds, okay? So just take deep breaths for me. Deep breath. Very well. Breath sounds are clear in all fields. No adventitious breath sounds auscultated. Okay, thank you. We are going to go ahead and move over to the couch.
Okay.
For the rest of your assessment. Next, we are going to continue by performing the heart assessment. We are going to inspect her chest wall precordium for any heaves or any pulsations, none which are noted. I'm going to palpate. Do you have any tenderness here? No? Very good. Okay, no tenderness palpated, no heaves palpated, and no thrills palpated. I'm going to locate the apical pulse, which is also called the point of maximal impulse. It is located at the midclavicular line, 5th intercostal space. Apical pulse appears to be a regular rhythm. Next, I am going to locate the landmarks, and I'm going to listen to them with the diaphragm and the bell of my stethoscope. So first we have here the apical area, which is at the 2nd intercostal space, right sternal border. And the pulmonic area, which is at the 2nd intercostal space, left sternal border. Erb's point, 3rd intercostal space, left sternal border. Tricuspid area, left sternal border, fourth intercostal space. And then the mitral area, which is at the fifth intercostal space mid-clavicular line. S1 and S2 present, no extra heart sounds, no murmurs. Her rhythm is regular and rate is normal. And I'm going to repeat this with the bell of my stethoscope. And that all sounds normal, no extra heart sound.
Bueno, ahora vamos a proseguir con lo que es la palpación, la cual consta de dos, que es palpación superficial y palpación profunda. Voy a empezar con la superficial. Si hay alguna molestia, me dice. ¿Dolor?
No.
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 ¿Dolor? ¿Dolor?
No.
Ok. Bueno, ahora voy a continuar con la auscultación profunda. ¿Dolor?
No.
¿Dolor?
No.
¿Molestia?
No.
¿Molestia?
No.
¿Aquí?
No.
¿Ahí?
No.
¿Dolor?
No.
¿Aquí?
No.
Y por último, aquí.
Tampoco.
Ok. Ahora proseguiremos con algunas maniobras para ver si hay alguna molestia o dolor en alguna región.
Ok.
Bueno, ahora proseguiremos a una palpación más específica. Voy a introducir lo que es mi brazo y usted va a inspirar y a exhalar. Otra vez. Otra vez. Otra. Y otra vez. Ok. Ahora, para ver si hay algún problema con el vaso, voy a proseguir introduciendo mi brazo y va a volver a inhalar y exhalar. Otra vez. Otra vez. Y otra vez. Voy a proseguir a tocar lo que es la aorta. Okay. Y las fosas y arterias ilíacas. Listo. Ahora proseguiremos con la percusión. Listo. ¿Sí? Bueno, ya hemos terminado con lo que es la exploración abdominal. Ya puede vestirse y
I'm gonna come and I'm gonna look through the hair, looking for any hidden skin discolorations. If you had kids in middle school or elementary kids, looking for nits and lice, looking for any scales, and then just feeling the skull for any like cysts or any pain or tenderness that the patient might have. Everything feels good. Any pain? Nope. Nope. Okay. Good. All right. Then I'm just gonna palpate the parotid gland, which is just right on front here, feeling for asymmetry, which they feel normal and not swollen or anything like that. Next, I'm going to listen to your temporal artery, so you'll feel the stethoscope kind of on the side, and then I'll listen to one over your eye. Okay.
Sounds good.
So here, so making sure it's on the bell side, and then listening for about 5 to 15 seconds. This side. Good. Then you're gonna feel this over your eye, just a little pressure, shouldn't hurt. So go ahead and close your eyes. Start with side. Good. Move to the other side. Good. Okay. All right. Then we're just going to test cranial nerve number 5. So you're going to feel some light pressure kind of on your forehead, along your cheekbone, and along your jawline. And I'll have you close your eyes and just let me know if they feel the same. Okay? Good. So let me know if this feels the same. 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 Okay. Over here. Same. Okay. And then here. Same. Good. All right. Then I'm going to, then I would be testing the blink reflex with a cotton swab on the cornea. I would be doing this with a sterile cotton swab, so I'm not actually going to elicit the blink reflex, but what I would do is I would take a cotton swab and I have the patient, I'd have you look away, but have your face stay towards me, and then I just kind of lift up and I would touch the white of the eye, then I'll have you look that way, or to, yep, and then I would do the same on this with a different cotton swab, not the same one. Looking for that blink reflex. Then, all right, so then I'm gonna test the muscle portion of cranial nerve 5. So I'm just gonna have the patient, so I'm gonna have you bite down on the tongue depressor lightly, not to break it, but, and then I'm just gonna kind of pull away. So I'll have you open up, go ahead and bite it. Oops, there we go, go ahead and bite. Good, and it looks good. and then we'll test cranial nerve 7. So I'll have you wrinkle your forehead. Good. Have you smile. Have a frown. Good. And then puff your cheeks. Looks good. Perfect. All right. So next we're going to move to the mouth and oropharynx. Starting with the lips, looking at the color, moisture, looking for any lumps, scars, bruises, cracking, ulcers, anything like that. Then I'm going to inspect the cheek. So I'll have you open up and then use my pen light, and I'm just going to looking for any bite marks, anything like that. Looking at the hard palate, looking at the gums, looking at the teeth, making sure they're all nice and pink. And then looking at the size of the tongue too, looking at size, color, and texture. Then I'll have you lift your tongue up towards the top, looking at the frenulum, and then looking at the ducts, making sure they're not blocked. So lift at the hard palate, which looks good. Then I'll depress the patient's tongue, have the patient say ah, looking at the tonsils and posterior pillars, looking for any redness or exudate, which there was none, so that's good. And soft palate and uvula looks symmetrical, so that all looks good. So next, I'm going to test cranial nerve 9 and 10. So you're just gonna feel this touch the back of your throat, essentially. So I have you open up and just feeling on the back there. Okay, good. And then, was all normal. And then I'll have you stick your tongue out to test for cranial nerve 12, looking that the tongue comes out straight and doesn't deviate to one side, and isn't fasciculating at all. Then I'll have you stick your tongue out again. We would be using a sterile gauze pad. We don't have one, but I just have her stick her tongue out. I'm gonna grab her tongue, and I'm just gonna look at the sides of her tongue on each side for a better look, looking underneath as well as on top. All right. Just to have, a better look. All right, then we're gonna inspect the external part of the nose, looking at it for symmetry and any deformities. And then we'll take a look on the inside of the patient's nose. So, okay, you're just gonna feel this go up your nose, have you tilt your head back. Good. I'm just gonna hear. Good. Okay. Then we'll take another one. So looking good, looking at the mucosa, the color, if looking for any swelling or discharge, and looking for any perforations or deviations, and looking at the inferior middle turbinates, that's how you say it, for any color, swelling, exudates, or polyps, which there was none, so it looks good. So next we'll do the nasal patency test. So I'll have you take your right hand, cover your nostril, and then have you breathe in and out that nose. Good. Have you do the other side, breathe in and out. Okay. Get a little blocked on the left side. That's all right. All right. So now I'll palpate your sinuses. I'll start with your maxillary, then I'll move to your frontal here. So just feeling the area for any swelling, heat, anything like that. I'm just gonna kind of push on it. Okay, let me know if you feel any pain. I'm just gonna percuss on them, okay? Any pain? No? Okay. So now I'm just gonna feel these sinuses for any heat, swelling, anything like that. And then here, can we percuss on them? Any pain?
No.
Okay, good. All right, so now we're gonna inspect the neck. So looking at the neck for skin tone lesions, scars, masses, edema, and unusual pigmentation, swelling. And then looking at the trachea to see that it's midline and not deviating to one side. And then I'm gonna use my third middle digit here and right above the, what is it? It's the supratracheal notch here. And I'm just gonna have the patient swallow, feeling that the trachea stays midline and doesn't deviate to any side. Then I'm going to inspect the thyroid gland, looking for any unusual swelling or anything like that. So I'll have the patient tip their head back and using a tangential lighting and go on this side looking for any shadows. Good, okay. And inspecting any masses or asymmetry. So then I'm just gonna palpate here. Okay. Then I'm gonna have the patient swallow, again feeling that the trachea stays midline and that the thyroid gland isn't causing any deviations, which feels good. Next I'm going to feel the lymph nodes, so I'm just gonna come behind patient here, and then you're just gonna feel me feeling the lymph nodes. So starting with the preauricular, so right in front of the ear here, feeling that they're small, round, and even. Coming to the postauricular, feeling those coming back to the suboccipitals and occipital lymph nodes, which feel good. Then coming to the tonsillar, down in here, working to the sublingual, or submandibular, and then sublingual. Alright, and then feeling, following the SEM, feeling the superficial cervical chain, and coming to the back side of the SEM, feeling the posterior cervical chain, and then feeling the supraclavicular ones, and then the deep chain is, I believe, deep to the SEM.
Mm-hmm.
So, and they all feel good, smooth borders. All right, so next I'm gonna listen to the carotid artery. So you're just gonna feel with the bell of the stethoscope. You're just gonna feel it just along your neck here, okay? I'm just gonna listen to the carotid artery here. Good. And then on this side. Good. Okay. So those all sounded nice and strong and normal. And then we're going to test for cranial nerve 11. So I'm just going to place my hands on the top of your shoulder and then lift your shoulders up. Good. And then we'll test the upper trap and SEM. So I'll have you look to this side, and I'm just going to have you push in, making sure that other opposite side SEM is firing, which it is, and I'll have you do the opposite side on this side, and then looking at that SEM to make sure it's firing. And it all looks normal, so that is everything.
Perfect.